All right. Hi. How are you today?
Good. How are you?
I'm well, thank you. My name is Chris. I'm going to be going over Ray's insulin medication and just some safety considerations that we need to consider before we give it. Okay. So as we're going along, also, I just want you to know if you have any questions, feel free to ask. Feel free to pause me. No question's a bad question. So first, let's discuss insulin and what it is. So insulin is produced by the pancreas. It's a hormone, and it helps to transfer the glucose, the blood sugar, out of the blood and into the cell. And it gives cells energy to be happy, healthy, thrive, and do what they need to do. So in your son's condition, with Ray's condition, diabetes type 1, what's happening is his pancreas just isn't producing the insulin that it needs. So because of that, he's going to need a long-term insulin therapy in the form of small injections throughout the day to just help manage those blood sugar levels throughout the day. So Ray has been prescribed two different types of insulin. He's been prescribed a long-acting insulin and a short-acting insulin. So long-acting insulin is your Lantus, L-Lantus long-acting, kind of easy to remember with all the L's there. That's going to be administered once a day in the morning at the same time every day. So that's it for Lantus. Short-acting is going to be your Humalog. Logs are rapid-acting insulins, and this is to help control blood sugar spikes that occur after you eat. So when you take in a meal with a lot of carbs, your blood sugar is going to spike, and because of that, you're going to need that rapid-acting insulin to help compensate for that spike in blood sugar. So those are the two different types that we're discussing. And then before we go into the actual injection method, I just really quickly want to touch upon the blood sugar readings. So in order to take a blood sugar reading, what you're going to need is your glucometer, the test strips, and your lancet. And you want to just choose a finger. You're going to kind of milk the finger like that. You're going to take your alcohol prep pad, wipe down the injection site, and you would lance the finger, get a small drop of blood, and you're going to take that drop of blood, put it onto the test strip, and then your blood glucose monitor is going to tell you the blood sugar reading. Your blood sugar reading should be between 80 and 130 before meals, and then after meals, you want to keep it below 180. So those are like the ideal kind of ranges that we're looking for. All right, and then without further ado, let's kind of go over the insulin administration. So when we're administering insulin, what we want to make sure is that first we have the right medication, of course. We have here our regular Humulin insulin. And we always want to make sure we have the correct type of syringe. So insulin comes in units, and this special type of syringe, an insulin syringe, also comes in units. And you can see here that it's labeled with units. So that's how you know it's correct. Before we go over like the actual withdrawing the medication, let's just talk about injection sites. So there are 3 sites you can choose. The most common is going to be the belly. You want to do 2 inches from the belly button, or you could also do the upper arms or the front of the thighs. Those are all appropriate spots. With the belly, like I said, just make sure you give those 2 inches from the belly button. And another really important thing is just rotate the injection site. So don't keep doing the same injection site because that's going to cause scarring, and then your insulin's not going to go through the scar, and it's not going to make the medication work. So that's important to consider. Okay, so before we begin our withdrawing the medication, we're going to go ahead and perform hand hygiene. This is perfectly fine. If you have hand sanitizer, you can also use a sink soap. That's also acceptable, of course. And then we'll go ahead and make sure we have the right medication. Great. We have our insulin syringe, perfect. And we would take our alcohol prep pad. You want to wipe down the insulin vial just to prevent any kind of contaminant from getting in there if there was anything. And then as soon as you open your insulin, it's important to take into consideration that it's only good for 31 days after you open it. So a helpful trick is to just take a Sharpie and write today's date that you opened it, and then below it put the expiration date, a month from now. So that way you know if it's expired, you shouldn't use it. And then also when it's opened, you want to store this at room temperature, and you want to keep it out of direct sunlight, away from heat, and you want to keep it at room temperature. It doesn't need to be refrigerated, okay? So now that we have our materials, we'll go ahead and remove the cap to the plunger, we'll remove the cap to the needle, and we're going to withdraw air in the same dose, equivalent to the same dose we're going to give. So let's say we're giving 10 units of insulin. You're going to withdraw 10 units of air. You could see how that top of the plunger aligns with the 10. And you would go ahead and administer directly into the vial, inject that 10 units of air, and then we're going to make sure that the medication covers the needle, so you're withdrawing medication. As it gets lower, that can be a concern, so just make sure you're actually getting medication in there. And you're going to withdraw a little bit past the 10. This is just going to help to prevent air bubbles, because we're going to push out the excess. So I withdrew 15 here, and then I pushed back to 10, and that just gets rid of any air bubbles that were in there. Or alternatively, what you could do is just flick it, like so, and that would also remove air bubbles. Either one's appropriate. So now that we have our 10 units of medication, we would go ahead and withdraw our insulin syringe, and you would choose the injection site. Like we said here, we're going to use our belly, and you're going to pinch an inch, and you're just going to go straight in at a 90-degree angle. So we inject, and then we're going to hold it for 10 seconds, and that just helps the medication to absorb. Removing it sooner can just prevent that medication from absorbing if it needs to. So now let's spend 10 seconds. We remove the medication, the needle rather, and we would dispose of it in our sharps container. You can get a sharps container from the pharmacy, or alternatively, you can use like a plastic laundry detergent container that works just fine. Anything with like a twist-on lid that would prevent somebody from getting a needle injury is fine. Okay, so now that we've covered how to give the medication, let's just go over some quick signs and symptoms to be aware of in case maybe you gave too much or you didn't take enough. So first we're going to cover low blood sugar. Low blood sugar is called hypoglycemia. Am I moving too fast for you? No? Okay. So hypoglycemia would be a blood sugar reading less than 70. So if you take that blood sugar monitor and it's less than 70, that means he's probably going to need a snack to bring those blood sugar levels back up. Some symptoms you want to be aware of would be dizziness, shaking, headache, confusion. You might have like a racing heart and blurred vision. These can all be signs of hypoglycemia. So if that does happen, like I said, we're going to give him a snack. You can give him a half cup of fruit juice, a cup of skim milk, orange juice, raisins, sugar cubes, an oral glucose tablet, hard candy, really anything with sugar to help raise those blood sugar levels. And after you give him that, I want you to wait 15 minutes and take the blood sugar again, and it should be back to relatively normal. And if it's still low, I want you to contact the provider so that we can make a plan to go forward. On the opposite end of the spectrum, so we talked about low blood sugar, now we're going to talk about high blood sugar. So high blood sugar might happen if you don't take enough insulin, or maybe you don't get enough exercise, so being like very inactive. It can happen if you eat too much food, or it can happen when you're stressed, or if he falls ill, gets sick. So some things to look out for, some symptoms with high blood sugar would be feeling thirsty, peeing a lot, feeling very tired. You might notice sores that don't heal. That's also a sign of high blood sugar. Unexpected weight loss, or once again, vision changes. If he does feel the symptoms of high blood sugar, I want you to check the blood sugar again. You're going to check it more often than you normally would to help monitor and make sure it's going down. And I want you to offer him carbohydrate-free fluids like water or tea. And it's important because he has type 1 diabetes that we just discussed ketones. Ketones are just this toxic chemical that can build up in the blood, in the urine, and it can make him very sick. So what happens with ketones is that the insulin, because the body isn't using insulin to transfer the energy, it's starting to break down fat instead of using insulin like it should. So because it's breaking down fat, a byproduct of that is ketones, which are toxic. So you should check for ketones in the urine if you notice the blood sugar is greater than 240 first thing in the morning, or if your blood sugar is greater than 300 at any time. That's a very high reading. Also, if he throws up even once, that's another important time to check for ketones. So you would use these ketone testing strips. It's kind of like urinalysis testing, the UTI strips, where you just you can either dip it into a cup with urine, or you can just pee directly onto the test strip, and then you're going to compare the color on the test strip to the side of the container, and it will tell you if ketones are present. And if ketones are present, you're going to call the provider, because that could be an emergency situation, diabetic ketoacidosis. And we just want to make sure we have the right plan moving forward to prevent complications from that. Okay. So just some things to be aware of with that would be trouble breathing, confusion, stomach pain, changes in vision, sweet, fruity smelling breath could be another sign, and extreme drowsiness. And the last thing I'd like to cover is just allergic reactions. So with allergic reactions, we want to look out for burning, itching, redness, swelling. If you do notice an allergic reaction, then you should call your provider so that we can discuss alternative medication plans. And if you ever notice any trouble breathing, any chest tightness, throat tightness, lip swelling, tongue swelling, anything that could impact the airways, that could be an emergency situation, and you want to get into the ER in that case. Okay. The last thing I'd like to leave you off with is just he should always have an identification on him so that people are aware of his condition, type 1 diabetes. So that can be in the form of a medical bracelet, a note, some kind of identification so people are just aware of what he's going through. And he should always carry some form of sugar, quick access sugar in his pockets, like a hard candy or any of those other alternatives that we discussed earlier, just in case he starts feeling those hypoglycemic episodes, and it can help reverse that. Okay. Do you have any questions for me?
I don't.
No? Okay. So in the meantime, I will leave you with some more information in the form of pamphlets, some educational videos. I will give you our contact information so you can contact us if you have any questions. And otherwise, it was nice to meet you, and I'll be back soon. Thanks.
Thank you.